Welcome to this week's episode of Time Out with GC. On screen, you can see the one and only Dr. Thulja Trikamjee. Thank you so much for joining us once again on the show.
Thank you for having me, Gashan.
Always great having show friends and friends on the show that we can call friends. But you are also outspoken regarding the vaccine, COVID. You are a COVID survivor yourself. And yet people are thinking that, hey, COVID is not real. Why should I go for the vaccine? And we're hearing about third wave.
Well, we're not hearing about third wave. I think now South Africa knows that we're well in our third wave. There are provinces that are not just in a third wave, but have peaked higher than our first and second waves. As a healthcare worker, I can tell you that our hospitals and our practices are starting to fill up. And we're seeing more and more patients testing positive, and we're going through what we went through the first and second time. So yes, the third wave is very real, and we're in the midst of it now. So it means starting once again, something that we are all too familiar with. I think at this point, people are smart. We know we've been through this before. We've been cautioned about this before. Many of us have had loved ones, or at least known somebody who has been severely ill, suffered, or even succumbed to COVID-19, and let that be warning enough or evidence enough that COVID is very, very real.
Now, Dr. Thulja Trikamjee is an allergologist and a pediatrician. I invited her to come into studio. She said, Gershon, let's rather do this on Zoom because I do not want to even take a chance to potentially getting COVID.
Yes, it's about getting COVID, but I think it's also about just being a responsible human being. I think that just knowing that our numbers are climbing and knowing that this is a virus which is transmissible in the air, mobility is a very big issue. As a healthcare worker, I have been vaccinated, and I have been vaccinated a while ago. So scientifically, I should have some degree, or whatever degree my particular vaccine offers, to COVID itself. But that said, my personal decision, and I think that it's a decision that many healthcare workers are taking, is moving around should only be done when our numbers are rising and this high, when it's absolutely necessary. So for my personal life, I'm actually only moving out of my home when I'm going out to see patients. And to save a life. And I think if we get together as a community and realize that this virus is something that is not necessarily only going to attack you if you directly touch or come into contact with somebody. When the virus is at its highest in a country, when it's riding the peak of the wave, it's actually in the air, it's everywhere. And with the current variant being the Delta variant, which we all have heard about in the media and the news, what the science says is that this variant is far more virulent and it's far more transmissible. So some of the data that we see is telling us that with the first and second wave, you would have had to come into contact with somebody or touch something for perhaps a few minutes. They're looking at 5-10 minutes or at least a minute or so. With this virus, because it's in the air, you can transmit it to somebody and you can pass it to somebody within a few seconds. So even though I'm vaccinated, Gershon, I don't want to be a person who adds to transmissibility of a virus. What I tell everyone now is be part of the solution, not part of the problem. So even after you've been vaccinated, even though you're wearing your mask, try to do your bit for humanity. You might not get ill, your child or your husband or wife might not get ill, but there might be somebody old in a family where you, by somehow, some chance, are passing on your droplets from someone to another, touching a keypad in and out of your own estate, a security guard who you might open your window to wave at, who goes home to his family, who might not have the same protection you have, might lose somebody in his home. So I think it's just about being responsible and doing what's best for the community.
Indeed, we do not want to be super spreaders. Just looking at some of these stats, Dr. Trikamjee, daily deaths have gone to 157. We've got recovery rates of 89%, but the active cases are climbing, as you said earlier.
The active cases are climbing, and the active cases are going to continue to climb. As most of us know, till to date. Gauteng is seeing the brunt of this third wave currently. But just from knowing how a virus, any virus, not just COVID, any virus kind of mutates and moves in a community, if Gauteng is anything to go by, once this virus enters other provinces, we may potentially see the same kind of climb and the same rise and the same rate of hospitalizations and deaths. So we need to do all we can right now. The number one thing is making sure that we are taking all the measures which we have repeatedly highlighted on our show already. And I think our viewers are well educated in that now. The viewers of Time Out with Gershon, with Time Out with GC are extremely smart when it comes to COVID with all the information they've been getting. But the number two thing is vaccinate, 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 vaccinate. It is our only chance to eradicate this virus. We had said during the first wave that there may be a third wave and there most likely will be a fourth wave. So if we don't now deal with ourselves and our bodies by providing immunity to bigger communities, and that means vaccinating more and more people, this virus is going to continue to grow bigger than us and outsmart us. The vaccine is our way of using science to kind of outsmart the virus, and we need to use it. We've got the tools now, we need to use it.
Many people, we said this also before, and we spoke about it before we started this interview, that people are thinking, why should I go and get myself vaccinated? Because they're thinking that maybe it's a way of government trying to get information. We spoke about 5G. There are so many people who have have said so many things about their vaccination. You yourself had your vaccination. Can we just explain to someone out there what happens when you get vaccinated and how your body reacts?
So what a vaccine does for everybody, and this is a simple way of understanding it. Firstly, vaccines have always been around. And people who have hesitancy towards vaccines have always been around as well. As a pediatrician, this is something we deal with. The difference now is generally we vaccinated the younger population, which is children, and that's part of our normal immunization schedule. And it's the first time that we're having mass vaccination. Possibly in the last couple of decades or even century, where many people have to be vaccinated irrespective of their age. So the first thing is there's a lot of fear attached to it. In terms of the fear that people have, you've got a group of people who are hesitant towards vaccination, and those who are afraid of it and not sure of it are getting easily swayed by lots of the negative information and sometimes the false information, the non-scientific information that they're getting. So the number one thing is just make sure that whatever you're reading, whatever you are receiving on your WhatsApp or on your messages or on your emails, verify the source, see where it's coming from. Know that vaccines are something that have been scientifically based. So if anybody is having a comment about vaccines, it has to be somebody with a scientific background. And just to go through in a nutshell what a vaccine does, Gershon, for those people who might be afraid of it, is a vaccine is, so I'm hearing stories about vaccines causing COVID in people. I'm hearing stories about male infertility and all of the other often bizarre things such as gathering information. What a vaccine does is it mimics a virus in your body. So you've got almost like genomic cells or genomic sequencing from a certain part of a disease. And in this case, it's SARS-CoV-2. And it's specifically parts from the spike protein that go into your body. And what it's meant to do is it's meant to mimic the infection in your body so that your body does what your body is supposed to do. Your body then is going to react by then inducing two types of memory and cells that then know that the next time we get exposed to this specific virus, we're going to use these two types of cells and we're going to fight it off. Now, there are many different types of vaccines, as we know, and different vaccines work on what we call different vectors, but essentially the point of the vaccine is to get your immune system to have a memory. So the next time it gets exposed to SARS-CoV-2, which it may well be exposed to with the multiple waves, that we know how to deal with it. A vaccine is meant, because this is another cause of hesitancy that I'm seeing. people who have been vaccinated are still testing positive. So it's creating lots of loss of faith, I would say, in the efficacy of the vaccine. So the point of a vaccine is not to prevent infection. I think people need to be very clear about that. The point of a vaccine is to prevent disease. So a vaccine would still potentially make you be exposed to a virus and get the virus, but you are less likely to become severely ill, you are less likely to be hospitalized, and you are far less likely to die if you already have some degree of immunity.
At the end of the day, Dr. Trikamjee, it's up to all of us to be responsible, as you said earlier, and we don't want to become a statistic.
No, we don't want to become a statistic. We need to, as a world, I think it's not just as a country, but as a world, come together and just realize that whatever we do, whether it's the stringent measures that we need to use now during the peak of our third wave, or choosing to vaccinate, it is not for us as an individual. What we're doing is to protect ourselves, it's to protect our immediate family, our immediate community, and actually, you're protecting the world. You actually are protecting the world by choosing to do this, because the only way planet Earth is going to eradicate SARS-CoV-2 is by what we call herd immunity. And herd immunity basically says that the virus needs to, on its own, realize that I can stop floating around, entering human bodies, and keep replicating and keep making new variants. Essentially, that's what's happening. So once we have 70% of people that are vaccinated, when the virus is floating around deciding, should I go to New Guinea? Should I go to Australia? Should I go to some place in South America? When they find that the percentage of people who are vaccinated are far greater, the chances of the virus entering the human body, because they use humans as a vector, the chances of them entering the human body, transmitting through the body, and then creating new variants are far less. And that's how eventually, it's not going to happen immediately, eventually we would be able to eradicate this virus. If we do not do this, as the months and the years go, the virus is going to keep finding people who don't have immunity, if that's a large group of people, and keep mutating. And we're going to find, as we are seeing, that the mutations are getting more and more dangerous, more and more severe, more and more virulent. And we unfortunately are losing more lives. So do it for yourself, do it for your family, do it for your community, and do it for the world. We each have a chance to be a hero now. I said this at the start of the pandemic when we went into a lockdown. This is everyone's chance to be a hero. And a new thought I've had is I think that everyone now is a frontline worker. As doctors, we have to give up the right to call ourselves frontline workers, because frontline is anybody who is exposed at the front line of this virus. And now in our third wave, with so many people being infected, everyone is at the front line of this virus, and everyone should be given access to the vaccine, and everyone who gets it should not be afraid to take it.
Dr. Trikamjee, as always, it's great to have you on the show. Thank you so much for speaking from the heart. And as you said, also by now, the viewers of Time Out with GC, they've been educated by you, by your professionalism, by your information regarding the variant and also COVID-19. Thank you so much for joining us on this week's show.
Thank you for having me, and thank you to the viewers for always being so warm and welcoming.
In order, with regards to the Coke Cup, there's ongoing discussions with Coke. Coke want us to push it a little bit back to our initial start now in July. So that's the discussion currently we're having with Coke.